My name is Lars Lindsköld and I work on a national level in Sweden in a program we call SweLife. And I have a specific project there we call Sweeper that is actually looking to how we can do better use of health data for personalized medicine. Coming from healthcare, it's very natural for us to understand how important it is with data. And when I use the word data, I'm thinking about data as the form that will create information that can be used by clinicians and nurses and patients to get a better understanding of their sickness and to better make them healthier. So I think that data is probably the most important assets we will have for the future of mankind, to be really honest. And I'm very impressed over the initiative from HID to actually work together more and more over the geographical boundaries that we have in Europe. Because it seems like always that the value just increases with the volume. When I first heard about IHD was together with the pharmacy industry here in Sweden, specifically AstraZeneca. And for me, working my whole life with data and healthcare, it was just like a dream come true. You realize that it's so big efforts of understanding what we can benefit from using data in healthcare. So I strongly talk to people about this collaboration now, because we see in all countries that we are looking at these assets that health data is, how to do the best of it. And to have a paraply or an umbrella organization like IHD to really ensure that we will have the same possibilities in all countries in Europe is just a very good initiative. We always start to discuss about the quality of data, and I think it's very important that we have a broad discussion of what we actually mean with the quality of data. I used to say that data is probably the simplest thing in the world because it's 1 or 0. So the data has a quality by itself. So it's in a way the perspective that we put on the data that makes the quality. I used to say that we know all that bad data in is bad data out, but the important thing is that the data works as per today. So that's something I always try to remind myself of. We have good healthcare in Europe. Most of the things work very good. So the next step now is to better understand how we will look at the data with the same perspective when it comes to quality. So any initiative there to strengthen the way of how we are doing the coding or using the frameworks for codes, how we're using international standards to better exchange data and so on are important. When you talk about collaboration, it always means that it has to be something in for me also. So I think that one of the challenges we have with HID is actually to be on all levels. I'm truly impressed over the way we are including the patients, or as I used to say, the individuals, into this discussion and into this arena. I think it might be a good advice also to try to understand how can we include this with the politicians, on that arena, that we have a common understanding on how to do things together, from the decision making to actually the implementation and the usage of the data. What the next steps should be to discuss in an open arena, I think it's one critical point we have to understand who is controlling the data. As per today, as I previously said, the GDPR is giving us some tools to understand that. But we must find ways so it's a benefit for all of us. For me, talking about controlling data is also to give the necessary feedback to the providers of the data, so that they see that they fulfill something by sharing.